Sharing and Wellbeing Program having me today at Wednesday webinar for Wellbeing. As a Wednesday webinar, Wellbeing is all 3 W's. We start with W's and we go for presentation. The first slide, basically, I'm talking about wellness, which is the practicing of habits on daily or regular basis for a better physical and mental health outcomes. Basically, it's critical for us to understand these habits and how they are linked to our health and lifestyle choices that lead to state of health. Basically, it's very much related to our self-responsibility for these choices, behavior, and the modifications that we can make here and there to achieve the goal of our physical and mental health. Basically, the very first W I'll be talking about is the weight. And basically, I guess I just went one slide ahead. Yes, it's our weight. And why weight? Because increase the weight and our body fat, it's called obesity, which is a condition, can place us in basically unhealthy amount or distribution of fat. And to measure this obesity, researchers commonly are using a scale that we call body mass index or BMI. Basically, what is this obesity? It's a number or a range of BMI that we calculate from our weight to height. This measurement and the calculator link I already placed here, so can be downloaded later if you wish to have on an app on your cell phone to be able to calculate it yourself. It's called normal usually when it's standing between 20 to 25-ish. Between 25 to 30, we call this like an overweight zone. Above 30, it's called obesity, and above 40 is a severely or morbid obese. Basically, why I read the 25 to 30, because this is the very first step of abnormal range that we can highly manage with our lifestyle choices. And these W's that we'll be talking today about play a very important role, that we can bring it back to the normal number, which affect our health very highly. Basically, as I just mentioned, the obesity is increased our body fat, and it's coming with increased risk of many serious conditions and health issues. The health problems that research already shown associated with these problems are unfortunately all causes of death and mortality: high blood pressure, which we call hypertension, abnormal cholesterol panel, which is high LDL, it's a bad cholesterol, and low HDL, which is the good cholesterol; type 2 diabetes, which is very common and increasingly in our nation; coronary heart disease, and stroke also. Many other conditions related to increased weight. It's as known as osteoarthritis, when we have all this pressure on our joint and cartilage. Sleep apnea and breathing problems, which is very important to be evaluated and treated, because it's a risk for nocturnal hypertension, and also it's a risk for a stroke. Many types of cancers related to obesity, low quality of life, and of course mental health, such as clinical depression, anxiety, and other mental issues. Body pain and difficulty with our physical functioning also very much related with this problem. The cancers have been associated with this. Basically, we have consistent evidence that the higher amounts of body fat, unfortunately, associated with risk of number of cancers like endometrial cancer, esophageal, gastric, liver, kidney, multiple myeloma, meningioma, pancreatic cancer, colorectal, gallbladder, breast, ovarian, and thyroid cancers that I placed a photo from our cancer.gov society and obesity relation to this problems. But how might the obesity basically increase this risk. In a nutshell, we need to know all this high fat tissue can alter our immune response. It's affecting the oxidative stress and basically nuclear factors that affecting our cell turnover or mutation to cancer problems. What happened during this COVID-19 pandemic, unfortunately, the higher BMI showed the risk of severe illness with this problem. Some data suggest that obesity may triple the risk of hospitalization during COVID-19. Obesity was linked to impaired immune function, decreased the lung capacity and reserve, and can make ventilation difficult. More than 900,000 adult COVID-19 hospitalization happened in the United States from beginning of pandemic to November of 2020, and the models estimate about 30% of these hospitalization were attributed to higher BMI. This is the map of our country that came out from CDC in 2019, and unfortunately, majority of our states is standing at dark orange and red color, which is showing more than of 30 to 35% of BMI, and those are the references that related to the talk of the weight issues and obesity. I placed the slides of references of each W right after I speak, so you can review that later on if needed, or if patients or community need to go through it. The next W I'll be talking about is our daily walk and physical activity, basically how much we work out and how this can affect our health. Our physical activity has a linear relation with our health status. Basically, physical inactivity is a modifiable risk factor, and we see that it's increased the cardiovascular disease, hypertension, cancer of colon and breast, obesity, bone and joint disease, including osteoporosis, osteoarthritis, and mental health issues like depression. Basically, regular physical activity and high fitness level associated with basically increased premature risk of cardiovascular death in both women and men. And a very modest enhancement in our physical fitness, basically from previously sedentary to more active, associated with drastic improvement in our health package status. The increasing research supports the importance of regular physical activity for primary prevention of type 2 diabetes. Randomized controlled trials showed the lifestyle intervention that included just a moderate physical activity, about 20-25 minutes walk a day, which is like a 150-minute of activity per week, found to become more effective than metformin alone to manage the glycemic panel for a patient who has abnormal glucose. I had many cases that they came to us in nephrology clinic with abnormal sugar in pre-diabetes stage or just the beginning of diabetes, with about 10-15 pounds of weight loss and 20 minutes of walk. They went back to normal glucose status and they're not taking any medicine. Basically, weight-bearing exercise, especially resistance, have the greatest effect on bone mineral density. If it comes to women who are post-menopause and they have different change of basically hormonal status and higher risk of bone mineral change, the weight-bearing exercise is very much helpful, including daily walk or hike. And the risk and incidence of fracture also reduce among active people. Routine physical activity is very important in preventing loss of bone mineral density, osteoporosis, and I just mentioned to post-menopausal women. The public health policies are needed. We all know that many barriers out there. And basically, we need these policies to reduce the barriers of physical activities so everyone can receive the benefit of this. Basically, we are highlighting nonstop the sedentary time carries independent health risk. Right now, I'm standing and talking, and the posture of us during work is very much affecting our health status, particularly sitting time. So the simple message of move more and sit less is basically formed on the basis of very strong body of evidence. There are many researchers out there, expert scientists and principal investigators of trials, that they are advocating the strength-based approach to our health and promotion with the focuses of innate strengths of individual families, communities, to enable this self-empowerment and self-determination to our own health and wellness with all these lifestyle choices that we can modify together. These are the references as far as physical activity. The next W is our wake and sleep hours adjustment. Basically, enough sleep is important for people of all ages to stay in good health. We might cut back on our sleep for like work, family members, and watch a good show on TV, or many of us go to bed with our smartphone and still watching the screen, and we forget how much of our sleep or resting duration or quality can be affected with that habit. Even one night of short sleep can affect our mental and physical basically function the day after. But why not getting enough sleep? It's an increased risk. It can be related to obesity, to type 2 diabetes, high blood pressure, to heart disease, stroke, poor mental health, and even early death. The guideline from CDC came out recently that how much this can affect our health package. You see, all these W's that I'm talking one by one, it comes this package of obesity and type 2 diabetes and high blood pressure, heart disease, stroke together. We've not been talking about medication yet. We're just talking about lifestyle choices and bringing the package of W's together. The American Academy of Sleep Medicine suggesting adult of age 18 and 60, just here, that needs at least 7 or more hours sleep per night. If you have a teenager at home, that person needs between 8 to 10 hours. For a school-age kid, 9 to 12 hours. So the younger we are, the more hours of sleep we need. But for most of us, adult 18 and older to age 60, we need at least 7 or more hours. What about our sleep quality? Imagine you're resting 8 hours, but you still feel tired the day after. So the quality of sleep matters a lot. And signs of this poor sleep quality, like being sleepy the day after, repeatedly waking up during the night, having symptoms of sleep disorder like snoring, gasping for air, and which is very common also in people with OSA, which is obstructive sleep apnea. This is a very common risk factor for nocturnal hypertension and unfortunately stroke in future. So that needs to be evaluated and treated. Given recent advances in technology and all this, the small CPAP portable machines that are available to us, it's very much easier to manage and treat, and it affects our blood pressure and future risk of vascular disease and stroke. So any symptom of a sleep disorder, if your spouse says you're snoring, if you feel very sleepy during the day, and you know that your quality of sleep is not good and something is wrong, please discuss to your doctor. There are many recent advances for sleep treatment, counseling, and management. But there are habits that we can improve our sleep. First of all, being consistent. If we go to bed at the same time each night and getting up the same time in the morning, including the weekends, that can affect our sleep habit and quality. We need to make sure our bedroom is quiet, relaxing, it's comfortable temperature. And the most important thing these days is advances of electronic and technology in our bed. So remove the electronic devices as possible from your bedroom, including TVs and computers. Avoiding large meals and caffeine right before bed is very helpful. Do not use tobacco at any time, not even before bed. We don't recommend tobacco and smoking at any time, but it affecting the sleep as well. Getting some exercise. We're going back to the other W again. that physically active people fall asleep easier at night and have a better rest quality. Basically, people with insomnia have trouble falling or staying asleep. Anxiety about falling asleep often makes us and this condition worse. So most of us have occasional insomnia, but chronic insomnia that I just redlighted here is at least 3 nights per week for more than a month. This can trigger serious daytime problems such as exhaustion, being irritated, and difficulty concentrating. The references for our weekend sleep adjustment. The next W is the water intake. When it comes to nephrologists and us as kidney doctors, we take many questions as far as water intake, how much is needed, how much is affecting our health. Basically, why water? We all know that optimal hydration is a key component to our health package. And what is the best choice of beverage and why is water? Is because it's free or easy to find the nearest tap or other data behind it. Basically, water accounts about 60% of adult body weight. The perfect 0-calorie beverage, and it rehydrates your body. It helps to store fluids lost through metabolism, sweating, breathing, and removal of waste. All the urine production happens with kidney persistently, is basically filtering blood and needs the water along with extra solute and breakdown of protein, waste product, medication, supplement, etc. to form urine. It helps with digestion. That's why people who are dehydrated are more constipated. If you drink enough water per day, the chance of constipation goes lower. Basically, it maintains a healthy skin, it lubricates the joints and tissues, and keeps you safe from overheating. I was trying to pour this water with not this much of pressure that caused this bubbles. It looks like a sparkling. We took these photos just a few days ago before this presentation. It's just the regular tap water. But how much water do we need? Basically, it's a very familiar saying that there is glasses per day for every person. The National Academy of Medicine suggests about 13 cups, 13 cups for men 19 and older, about 9 cups for women 19 and older. For a pregnant woman, about 10 cups. For breastfeeding women, about 13 cups. But keep in mind, the amount of body water need for every person might vary based on different medical conditions, their age, their body size, muscle mass, and fat ratio. But in general, 13 cups for men and 9 cups for women recommended. But when you come to my office and you have kidney stone, definitely I will give you other recommendation as far as water intake and increasing the urine volume. There are conditions that increase fluid needs, like exercising. If you're exercising during the day, it's a different body fluid need rather when you're exercising at night. If you're not heat exposed, if you're exposed to sun and it's extreme temperature out there, the body needs for fluid is higher. If you're sick and you have fever or excessive loss of body fluids during like sickness with vomiting or diarrhea, you need more of a fluid replacement. Sometimes we need fluid and electrolyte replacement. What about water and our urine? The urine concentration is very much related to water intake. And the volume and color of urine can give us estimate of hydration, basically. The lighter color of urine, the less concentration. The darker urine, the less water in it. So it's going to tell you about how much water you might need. However, there are some medical conditions that your kidney might be affected and you're still drinking enough water and you're not concentrating, but those are not too many. Urine color can change. It can change with food, with medications, with vitamin and supplements. But keep in mind the smaller volume of urine might indicate and you're dehydrated, especially if it's darker. What about sparkling waters? The sparkling water, are they healthy? We get these questions a lot. The process of carbonation makes the water becomes bubbly, and carbonation involves dissolving carbon dioxide gas in water under high pressure. And to basically, this process can lower the pH from 7 to 4 and makes it more acidic. What happened when it's more acidic? Is it like harmful? Is it any concern here? There are many research for sparkling water for teeth and bone health. Actually, the research has not shown that carbonated beverage associated with like dental decay or other issues, unless if they contain sugar or other sweeteners like high fructose corn syrup. Also, studies did not find that carbonated beverage associated with decreased bone mineral density. But keep in mind, if you're drinking this carbonated dark colas, they might have a lot of high phosphorus content, and that can carry a risk sometimes for bone health, especially in patients with chronic kidney disease and lower GFR, which is filtration rate of kidney. Infused water is my own choice of water. I make my infused water every night and keep it in a pitcher jar of water in the fridge. And during the day, I carry this in a thermos, and it keeps it very fresh and good temperature. And I stay hydrated during work. So instead of purchasing expensive flavor water in grocery store, you easily can make your own infused water with. I added, actually, my friend added lime, lemon, and fresh mint here. And we can use a slight citrus or fruit or zest of lemon, lime, grapefruit, crush fresh mint, peel the sliced ginger, sliced cucumbers, or crushed berries. They all taste very good, but not together. You can use one per night, and it's very tasteful. Symptoms of dehydration, very important. Not everyone will have the same level of thirst with the same dehydration. Of course, you'll be thirsty when you're dehydrated, but if you're chronically dehydrated, you might feel more fatigue, sometimes confusion or short-term memory loss, mood changes like being more irritated. And yes, chronic dehydration can increase medical conditions like urinary tract infection, kidney stone, sometimes gallbladder stones, and constipation. As a nephrologist, I want just to briefly touch on ADH, which is a hormone we call antidiuretic hormone. What does it do? It comes from brain and it signals the kidney. Basically, it stimulates insertion of water channels into the membranes of the kidney tubules. It is fluid regulating hormone that basically tells the kidney to reduce urination and reabsorb water back to the body. And if you're like heat exposed and going to the desert like this person and very much in need of keeping your body water as long as possible, you need to say, thank goodness I have ADH. But ADH can be affected by alcohol as well. Alcohol can suppress ADH or antidiuretic. So without ADH, body flushes water more easily. So when we're enjoying more than a couple of drinks in a short period of time, it's a chance that we increase the risk of dehydration, especially if we are drinking on empty stomach. Some suggestions are that take alcohol with food and sips of water. And I advise everyone who's drinking more than a glass over to drink at night to have a jar of water or thermos at bedside. Even if you have to wake up and go to bathroom, it's better to stay hydrated. What about caffeine? Does caffeine have a diuretic effect? Is this potentially leading to dehydration? Basically, research does not fully support that. The data suggests that more than 180 milli of caffeine, which is about 2 cups of brewed coffee, may increase urination in a short period of time, some people, but will not necessarily lead to dehydration. Some data suggests that drinking caffeine in moderation, like 2 cups or less, can provide similar hydration qualities, water. However, if we are large volume drinker of caffeine, then can affect the diuretic, elicit the diuretic effect, and then we need to keep in mind that we might excrete the water out of the body and might not be the same level of hydration with water. So the references as far as water intake. Next W is not pomegranate, it's what we eat, but I just put a pomegranate photo here because it has a very nice reputation as far as a healthy fruit with a lot of antioxidants, and it's very pretty, of course. I went back. Yeah. Basically, I want to talk about Mediterranean diet because this traditional Mediterranean diet with a high intake of olive oil, fruits, nuts, vegetables, and a moderate intake of fish and poultry and low intake of dairy product, red meat, processed meat, and sweets. Wine in moderation with meals, of course. This Mediterranean diet, which has some nuts and olives, I already soaked all this in water, because if you soak almond and walnut in water, it's easier to chew, and when you soak olives in water, is less salty. And we hope one apple a day keep the doctor away. We spoke about pomegranate. Berries have a very good reputations of antioxidants, lime and lemon. Also avocado with a good healthy fat, and a piece of fish that is part of the Mediterranean diet. I placed different types of oil here, including avocado, olive, and walnut, but keep in mind they are oil and they still have high calories. So we need to use them in moderation. 1 tablespoon of each of these oils might be helpful to be added with some lemon, lime, balsamic vinegar, salt, and pepper, and adding to your salad. The combo of all this that we just discussed, which is a Mediterranean style, has been researched among persons at high cardiovascular risk. This diet, supplemented with extra virgin olive oil or nuts, reduced the incidence of major cardiovascular events. It came out in New England Journal of Medicine in 2013. There are many research since then on Mediterranean diet, metabolic syndrome, cardiovascular disease, and hypertension. I am pointing on hypertension for the next few slides. That is our specialty in nephrology field, and it's a raised blood pressure issue. It's staying as one of the most leading cause of death. Unfortunately, the prevalence of raised blood pressure and adverse impact on end organ like eyes, brain, heart, and kidneys are rising, increasing in US and globally. Based on the latest guidelines update, the definition of hypertension changed, and the normal blood pressure basically is defined number of less than 120/80. The top number is systolic blood pressure. The lower number is diastolic blood pressure. So elevated blood pressure is when we have systolic between 120 to 129. The diastolic is still less than 80. The stage 1 hypertension, when we have 130 to 139 of systolic and 80 to 89 of diastolic. The stage 2 hypertension, it's when we have systolic blood pressure more than 140 and diastolic more than 90. The diagnosis is not just one-time measurement at doctor's office when you have been stressed and traveling and you don't like to be there and you're anxious. No, it's based on 2 or more reading. It's much better to be at home rather doctor's office. We recommend everyone have a blood pressure device, even if it's not hypertensive. They are not pricey, they are easy, they're available everywhere on Amazon and any website that you can buy online, and it gives you more accurate data than doctor's office. So how to measure our blood pressure? It's very important, because imagine if you had a cup of caffeine, or your bladder is not empty, or you're stressed, or you had a cigarette. None of these numbers are accurate. You need to make sure you have a quiet, comfortable room with a good temperature, with an empty bladder, that you have been relaxing for 3 to 5 minutes. you have back support, feet on the floor, arms resting at the level of heart, a validated machine, then you can measure your number. You can save that number. Most of these data are Bluetooth friendly. They communicate with your smart device. My patients are sending the numbers per week just electronically. It's much easier to manage and care hypertension patients based on all these new advances compared to 10, 15 years ago. So that's how you can measure your blood pressure, and why we are keep mentioning blood pressure, because the end organ that basically you need to go on with life with them, vital organs, lifespan is much related to this number. The brain, eyes, heart, the vasculatures of arteries and kidneys, of course. But keep in mind, high blood pressure can cause kidney issue. When kidney is damaged, it causes hypertension. They have a chicken and egg relation. So kidney damage can be a cause and consequence of hypertension. But recommended lifestyle modifications to manage your blood pressure, mostly of these W's that we talked are part of it. Basically, sodium restriction, bringing salt less than 1,500 milligram a day, weight reduction to less than 20% of body ideal weight, 30 minutes of daily aerobic exercise, and use the dietary approach to stop hypertension. We call it DASH, very similar to the Mediterranean we just discussed, and limits on alcohol use. So I'm going to talk about DASH diet now, which is a lifelong approach to healthy eating. I myself use DASH. DASH is for everyone. You don't need to be just hypertensive to use it. You can basically prevent medical conditions like hypertension with DASH diet. It's designed to help treat or prevent high blood pressure, to lower blood pressure without medication. In research data that is sponsored by NIH, encourage you to reduce sodium in your diet, eat a variety of foods rich in nutrients that we just showed the photos. It lowers the blood pressure. This diet mainly have higher potassium. It has some calcium and magnesium and less sodium. It's very important to know that this diet may be able to reduce your blood pressure just in 2 weeks. And it can affect your number of blood pressure between 8 to 14 points. And keep in mind, the DASH diet is a healthy way of eating, and the benefits of it, besides just lowering blood pressure, is in line with dietary recommendation to prevent osteoporosis, cancer, heart disease, stroke, and diabetes. There are two types of DASH diet. The standard has a higher level of salt, like 2,300 milligram, and the lower sodium, which is 1,500 milligram. When my patients come to me and say, "Doctor, what does it mean 2,300 milligram? Just give me something practical that I can use," because it's not easy to count all this sodium like to 2,300 milligram. The best will be just to looking at the product label and the nutrient information. If a product is carrying more than 150, 200 milli per serving size, that's already telling you it's salty. So I recommend less than 150 per serving size, because you need at least 10, 15 different serving size of products to prepare 3-4 meals per day. So 150 or 200 per serving size of sodium is already salty. There are some hidden salts here and there that we might miss, especially if we eat out. We don't know how much salt is in that food. The salad dressing is loaded with salt. You can make your own salad dressing very nice and low salt or no salt at home. Also, salt is part of the preparation of the preservative that they keep food with it. So always look at the label and see how much sodium is going to your body per 24 hours. But both version of DASH diet has reduced amount of sodium compared to typical American diet, which can basically be to 3,000 to 4,000 milligrams of sodium a day. But if you're not sure about that, what sodium level is right for you, please talk to your doctor. We are there, we can help. DASH diet includes grains, vegetables, fruits, 4 to 5 serving a day. Dairy about 2 to 3, mostly low fat. Lean meat, poultry and fish, nuts and seeds and legumes. Sweets are there too. If you do not have glycemic panel issue or glucose, you can choose between 5 servings or fewer sometimes per week. Back to nuts, I just want to point it out. Sometimes nuts get a bad reputation because of their high calorie and fat content, but keep in mind they have a good type of fat, which we call monosaturated fat and omega-3 fatty acid. And yes, they are high in calories, so you can use them in moderation at your salad or mix it with your fruits and veggie for a snack during the day. Take it with you to work. DASH diet and alcohol and caffeine. So drinking too much alcohol is not recommended anyway, but keep in mind that can increase your blood pressure. And dietary guidelines for American recommend men limit alcohol to not more than 2 drinks a day, and for women, 1 or less. DASH doesn't address caffeine much, but we already discussed caffeine and diuretic effect. In some cases can cause to rise blood pressure temporarily. So if you already have like high blood pressure or hypertension issue, and if you think caffeine might affect you, please check your blood pressure after drinking your caffeine about 30 minutes to an hour after that, and see if it's really affecting your numbers or not, and then you can discuss with your doctor as far as effect of caffeine. Go back. Yeah, we talked about this one. Okay. This slide is showing some of the over-the-counter medication or supplements that can affect our blood pressure, because they don't need prescription to get it. You can take it without even discussing with your doctors. Imagine you have joint pain and a little bit of headache here and there, and you need to take some pain medication from the shelf of pharmacy. And the most important thing we need to keep in mind, if we are taking the category of non-steroidal anti-inflammatory drugs that it's called NSAIDs, these groups are like Advil, Aleve, ibuprofen, Motrin, naproxen, naproxen. They can affect your blood pressure. They can rise blood pressure in some cases significantly, and sometimes they can damage kidney. So if you are taking this on sometimes daily basis or for chronic use, you need to discuss with your doctor. Some of them carry risk. Some combined OCP and oral contraceptive pills with estrogen and progestin can cause elevated blood pressure. So if it's happening in your case, you can discuss with your OBGYN. Tylenol on daily basis might affect blood pressure, but here and there, 1 or 2, no. Some herbs can affect blood pressure. Alcohol definitely is part of the substances that increase BP. But as far as herbs or substance, if you are taking mahuang, ginseng, and high dose licorice, sage, and wort, yohimbine, and your blood pressure is not normal, you can discuss that with your doctor as well. They might be affecting the BP. So far, we spoke about many W's that might affect our blood pressure, and lifestyle choices can help with treatment of hypertension. Basically, our weight, very much important, physical activity, walk and workout, what we eat as far as salt intake. The work style also, or sedentary hours, can affect our blood pressure. Tension, stress, worry, some anxiety, no doubt that can affect your blood pressure. We need to watch our alcohol intake, weekend sleep hours, smoking cessation. These are the lifestyle choices that implemented from the research data, very strong data behind that can affect your hypertension management. But if you want to look at all the W's that we talked about, the winners among these W's in lowering our blood pressure here, number 1 is weight loss. You see, weight loss is affecting the highest. 5 to 10 millimeter mercury of blood pressure can be changed with 10 kilogram of weight loss. Number 2 winner is what we eat. DASH diet can help blood pressure to reduce between 8 to 14 millimeter mercury. These are significant change. Imagine you're standing at a systolic blood pressure of 134, and you bring this 14 point down to 120 just with DASH diet. With lifestyle choices, you treated your hypertension from stage 1 to normal BP without medication. Or you bring down your weight about 5 kilogram or 10 pounds, and instead of 140, you reach to 130 of blood pressure, you already dropped it 10 pounds. Very important to know that how these W's work in a package, and your lifestyle choice can affect your health status. One point as far as compliance to your doctor recommendation and prescription, basically, the study shows major reason for inadequate blood pressure in the state is about 50% of our patients are not adherent to antihypertensive medication, and most of them forget, and they have different work and lifestyle and hours that it make them busy and they forget their medicine, or they don't have access to it. The smartphones, apps, and all these reminder alerts shown significant improvement in compliance and adherence to medication. So if you are taking any medicine on a regular basis, I recommend to download an app for an alert. At the same time, every day is very much helpful for compliance. The reference of hypertension, there are too many. I brought them all here, and I want to talk about the last W, and music and medicine. This is my stethoscope and this is my piano. Sometimes I play, and I know when I play, I'm a different person, and the day after I'm functioning much better. Is it time for doctors to prescribe a daily dose of classical music? Is there research behind that? And what type of research we have? Basically, music has been a constant part of human culture since several hundreds and thousand years ago. Studies have shown positive effects of music on measured hemodynamic functioning, including our respiratory rate, heart rate, blood pressure, and neurological function. A randomized control study checked the effect of different genres of Mozart, Strauss, and ABBA. Subjects were randomly assigned to these three groups, and they listened to this for 25 minutes. Their serum cortisol concentration, heart rate, blood pressure were measured before and after listening to the session. They found that the music by Mozart and Strauss lowered subject blood pressure and heart rate, while ABBA did not. Of course, they all enjoyed all the three genres. However, the effect of hemodynamic was more significant with this classical genre of music, which was with Mozart Symphony No. 40 in G minor. So they concluded music genre remains an important consideration for studying music's effect on health. Another team of researchers, cardiologists at Oxford University, they found some classical pieces like Beethoven's Ninth Symphony are in sync with body's natural rhythm. So it can significantly lower this listener blood pressure. So far, several studies findings is confirming positive effects of music in both psychological and physical measure. It impacts our well-being, including mood, pain response, heart rate, respiratory rate, and blood pressure response, management of anxiety and depression. The hemodialysis patients of our patient population who are facing with these physical and psychological stresses on regular basis, imagine 3-4 times a week, coming to the center, sitting, getting treatment for 3-4 hours, and dealing with all this stressor. Music have been tried on many of them in different countries, and it shows it may serve to improve hemodynamic, blood pressure, heart rate, level of stress, anxiety, and quality of life in dialysis population patients. We came out with this logo a few years ago when we found the music and kidney program at UCLA. You see that I was thinking we can have the notes, music notes forming two kidneys that connecting with the G clef together. And our musician, composer, pianist, Mr. Shahidi, dedicated a beautiful piece of Chopin Nocturne 20 in C minor during pandemic to all healthcare providers, patients, and frontliners, heroes, basically, who were facing the challenges of pandemic with the message of relax and meditate against COVID-19. We all know music is wellness and mindfulness matters. Our psychological health highly impacts our physics and our outcome. I put this link here for you so you can enjoy this piece of music later. Basically, take home message from my presentation is, if you're using these W rules, please apply the changes gradually. Body doesn't like acute changes, and make sure you have micro goals so it will stay sustainable. Basically, it's a less chance of failure when you have micro goal than too many things in a short period of time. And make sure you talk to your doctors before applying any change to your regular lifestyle or diet. Make sure reward your success. And I want you to know this presentation is not recommending or endorsing any product of any brand. I'm just talking about a package of W's altogether. And these W's complete each other's when are practiced together, and it should be part of an integrated approach to enhance the healthy lifestyle behaviors. Monitoring weight, daily water intake, daily walk and workout, what we eat, and listening to a piece of music that if it's classical or waltz, I put because it has a W and I enjoy it. All together bring the wellness. If each of this W is like a music instrument, you still can enjoy them if you play in isolation, but when they come all together in a beautiful orchestra symphony, the effect is much more influential. I hope you enjoyed this presentation, and I'm ready to take questions if any.